Hello, I am Jonathan Yang. I am a radiation oncologist here at NYU. Today, I want to talk about this national trial, Nrg Bn014. This is a phase 3 randomized trial of proton craniospinal radiation compared to involved field radiation therapy for patients with newly diagnosed breast cancer or non-small cell lung cancer leptomeningeal metastasis. So the background and rationale of this trial was based on a phase 2 trial that we conducted and published in 2022, where we compare proton craniospinal radiation against photon-involved field radiotherapy, which is the most common form of radiation that's prescribed in patients with metastatic breast cancer or non-small cell lung cancer with leptomeningeal metastasis. In that trial, what we found was that proton craniospinal radiation improves CNS disease control or central nervous system disease control with comparable toxicity with the photon-involved field radiotherapy. And we saw that there was a potential impact on the survival. However, I think it's important to also keep in mind that it was a small study at a single institution. The primary endpoint, the primary aim of the study was to see if proton craniospinal radiation can potentially improve disease control. And we weren't specifically looking at survival outcomes. So therefore, as a field, we felt that it's important to explore proton craniospinal radiation further to expand from the small single institution study to a national phase 3 study, which is the current study that I'm discussing with you, in order to figure out, does this treatment, proton craniospinal radiation, will truly have a longer lasting impact in terms of the benefit and survival? And if so, it can potentially change how we approach leptomeningeal metastasis, at least from the radiation oncology perspective. In terms of the schema of the trial, the patients will go through two-step registration. The patient will go through financial clearance and followed by randomization based on patients' histology, their systemic disease status, and their recent or planned systemic therapy. Patient will be randomized to involved field radiotherapy and proton craniospinal radiation. The study is aiming to accrue 115 patients. At NYU here, we're hoping to enroll 20 patients, and here we're aiming to activate the study very soon. And in terms of primary objective, the main focus of the study is to compare survival between these two modalities to try to figure out whether one versus the other truly is more beneficial for patients with breast cancer or non-small cell lung cancer and leptomeningeal metastasis. And we're also looking at quite a few other endpoints, including CNS or central nervous system progression, free survival, or disease control. Also looking at the toxicity that a patient can potentially experience on both arms. And lastly, and this is very important to me personally, that we would like to compare patients' reported outcome to figure out either of these treatments are impacting patients' day-to-day function and how they're feeling, and whether one is better than the other in terms of helping their symptoms. And again, part of our exploratory objective is to focus on patients' reported outcomes using these two tools that we have used before in our prior studies. So for patients with known breast cancer or non-small cell lung cancer with newly diagnosed leptomeningeal metastasis who are candidates for radiation therapy, these patients would be potentially eligible for this trial. And if you're interested in finding out more information about this trial, I will encourage you to speak to your clinical care team and explore this option as a potential option for you. Thank you.